Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the Kidney Health and Disease video series. Today is the time for the sixth video of the series, that it is the immunosuppression for glomerulonephritis. Because we're going to talk about medications, it is important that I mention the following. This video is to give you an overview of the reasons for using immunosuppression and to present non-exhaustively monographs of the main use, benefits, and side effects of commonly used immunosuppressants. To decide what medications are appropriate for your condition, you need to consult your doctor and discuss with him or her the rationale, pros and cons, as well as contraindications that might apply to you. Thus, this video, and the entire video series in fact, is produced in good faith for patient education purposes only, not for diagnostic or therapeutic recommendations. So patients have more knowledge when discussing specifically the correct management and treatment for their specific conditions with their doctors at their registered clinics. So we're going to talk about the rationale of immunosuppressants, some notes on steroids, Cyclosporine, andtacrolimus, Mycophenolate, and cyclophosphamide, and some brief notes on plasma exchange. Why we use immunosuppressants? Normally, the immune system tries to protect you against infections by producing substances like something called cytokines or complement, antibodies that protect you against infections by killing bacteria or viruses. In glomerulonephritis, the immune system gets overactivated or dysregulated and produce an excess of these proteins and antibodies that can go and inflame the kidney and give you symptoms of glomerulonephritis. So we use these medications called immunosuppressants to suppress the function of the immune system and avoid they produce this excess of inflammatory proteins or antibodies. However, we also dampen on specifically the normal functions of the immune system. So patients have increased risk for infections as well. So let's talk about the steroids. Steroid medications are cheap, but they are powerful anti-inflammatory medications. They work well for many conditions, but unfortunately, they have many metabolic side effects, including increments in blood sugar, lipids, weight, and blood pressure. They can also weaken your bones and give you water retention. They can also affect mood, sleep pattern, and aesthetics. But it's important to mention that if patients are taking steroids for long periods, they cannot stop them suddenly. Steroids are hormones that normally your body is producing. But when you are taking them as medications, the gland in your body that normally produces gets lazy because it doesn't need to produce it anymore. So if you stop them suddenly, the gland needs time to catch up and start producing them again. During that period, you can be at risk of becoming hypotensive. That means low blood pressure, and even your life can be in danger because steroids are important hormones maintaining blood pressure and the content of fluid inside your blood vessels. Let's talk about Cyclosporine and tacrolimus. Unfortunately, they are expensive, but they are also effective medications for many conditions. They have also some metabolic side effects, increasing your blood sugar, lipids, or blood pressure. They can also affect the kidney. They can affect aesthetics, for example, cyclosporine, and increase slightly risk of cancer in predisposed individuals. But as I mentioned, they are effective to treat many glomerulonephritis. Some precautions include that you need to be aware that they can interact with many medications or even food. These interactions can cause the levels to go sky high or deep sea. So you need to inform your doctor when any doctor prescribes any medication that you're taking these drugs to prevent one of these interactions. We advise that monitor the levels of these medications. Ideally, they are best to be avoiding pregnancy. Mycophenolate is another drug that also dampens the immune system by inhibiting proliferation of the immune cells. It is expensive but effective for many conditions. It has side effects like diarrhea, low blood count, or infections, and needs not to be taken or carefully if you take other medications that inhibit cell proliferation as well, and needs to be avoided in pregnancy and breastfeeding. Azathioprine is another medication that is getting out of fashion. It's effective for some conditions. It is cheap, but also have side effects like low blood count, risk for infections, or even risk for cancer. It doesn't need to be taken with other medications that inhibit cell proliferation. You need to be careful not taking it when taking allopurinol, because the antiproliferation effects get worse, and best avoid also in pregnancy. Cyclophosphamide is another powerful medication with higher toxicity compared to the rest, but it's also effective for many conditions. It is cheap, but the side effects can be low blood count. In some patients can cause bleeding in the bladder, especially when given intravenously, can increase the risk for cancer, and can also risk for subfertility or infertility. So you need to take care that these medications are not taken with other antiproliferation medications, or your doctor needs to advise you on that. There are medications to prevent effects to the bladder. Ideally, should not be taken for long periods of time. You need to avoid them in pregnancy and breastfeeding, and the effects on fertility needs to be discussed with your doctor. There are other immunosuppressants that we use. For example, there is one called rituximab. I'm not going to give you much details about it, and many other medications that we use on patients with glomerulonephritis, typically the so-called antiproteinuric drugs, because glomerulonephritis is characterized by leakage of protein in the urine. Fish oil can be used in one type of glomerulonephritis. Because water retention is a special feature of glomerulonephritis, you can take also water tablets. Let's end up by mentioning a little bit about plasma exchange. But what is plasma? Plasma is one of the components of the blood. In the blood you have red blood cells, platelets, and white blood cells circulating in the blood. The plasma is the fluid surrounding these cells, where these cells actually flow or swim in your blood. In glomerulonephritis, as I mentioned, there is an excess of antibodies or these inflammatory proteins. They are found in the plasma, as you can see in this picture. So what you try to do with plasma exchange is get rid of those excess of antibodies. The plasma exchange is a machine you can imagine typical, similar to dialysis, but it's a little bit different, in which your blood is passed through a plasma separator or filter, in which this called dirty plasma, or plasma with the bad antibodies, is removed. The clean blood is returned back to the body of the patient, and because you remove plasma, you need to replace that plasma that you remove with fresh plasma or any other substituting fluid. So I hope you find this video useful. If so, please give us thumbs up. Please subscribe to the channel to stay tuned for our next video that will be replacing kidney function dialysis. Thank you very much for your attention. Take care.